The cost effectiveness of evidence-based child maltreatment prevention programs, I think, can best be couched in the conversation and discussion around what the national costs are for failing to invest in these programs. There are two recent studies that have been commissioned by Prevent Child Abuse America and by the Centers for Disease Control as recent as 2012 that took a look at the nationwide annual costs of child abuse and neglect. And those costs range from $80 billion to $124 billion dollars on an annual basis. And those costs include things such as children's medical costs, adult medical costs, loss of productivity, child welfare costs, juvenile justice costs, etc. And those numbers are astounding and they're disturbing. And naturally, with any study, you need to be careful in terms of how you interpret what those findings are. But I think the message is clear that the cost of doing nothing or not investing early really far outweigh the costs that it may take to implement any one evidence-based program with fidelity. We know that early investments in childhood, that investments in prevention are going to yield positive outcomes for children and families. We know that when we promote protective factors within families and really wrap our arms around communities, that we are going to see we're going to see benefits that I don't think we necessarily would have seen otherwise. We know that kids do well when families do well, and we know that families are doing well in communities that are doing well. And so if we are making strategic investments early and for the youngest children in families with the most needs, then I think that we will see benefits that far outweigh those costs. In North Carolina in particular, we see that an average evidence-based program that we are funding at the North Carolina Division of Social Services, for example, related to the Incredible Years or the Strengthening Families program or even Circle of Parents, may range anywhere from $1,500 per family to maybe $3,000 per family. And taken individually, that may seem a lot, may seem expensive in terms of a cost per family benefit. But if you were to analyze that in relation to what the child welfare costs may be annualized for kids in foster care, and you take those costs annualized across the nation in terms of what we know from the studies from Prevent Child Abuse America and the Centers for Disease Control, I think it's safe to say that the investments in early childhood and prevention programming are very wise investments that we need to be making.